Unelected global health dictators are meeting this week at the World Health Assembly, and while the pandemic agreement hasn't quite come to fruition just yet, Director General Tedros Ghebreyesus is still working to finalize a package of amendments to existing international law and formalize the draft of a new pandemic agreement.
My wish is we will come out of the assembly re-energized, inspired. We will try everything, believing that anything is possible, and make this happen, because the world still needs a pandemic treaty.
The global gathering of unelected health dictators began this week in Geneva, Switzerland, at the 77th Annual World Health Assembly, which is the World Health Organization's decision-making body. This year's theme is All for Health, Health for All. There are some pivotal moments anticipated from this year's gathering, described as the Pandemic Prevention, Preparedness, and Response Accord or Agreement, and, of course, the amendments to the international health regulations. It's an apparent concerted effort by member states to bolster global preparedness and response mechanisms. But as Canadian MP Leslyn Lewis previously pointed out, in a letter to Liberal Minister of Health Mark Holland, doing so would cede health authority to the WHO and erode national health sovereignty in times of emergency. And those emergencies are declared at the whim of Tedros anytime he believes that there is a public health emergency of international concern. Now, with the development of the elusive Disease X, a placeholder for future pandemics, it's really anything goes.
Disease X is a placeholder for unknown disease. I just wanted to start by clarifying that because there is already a lot of attention. If I may, although COVID came immediately, we were preparing for COVID-like disease. You may even call COVID as the first disease X.
Lewis notes that things like the pandemic treaty or accord or agreement would require Canada to adopt pandemic response measures as prescribed by the WHO, something that we did during the COVID-19 response, disregarding previously well-established and evidence-based pandemic response plans implemented by various EMOs or emergency management organizations.
Yes, every province and territory in Canada had plans. All 13 of 13 are available on pandemicalternative.org because we collected them, and the Government of Canada plan looked very similar to being a supporting plan for the 13 provincial plans. A supporting plan, not the leading plan.
And not a single government in Canada followed their pre-existing plan.
In my opinion, they burnt them all. Every premier in this country knows they have an EMO. It's in their briefing book. It's there the day they become premier. When I left the Army, I became part of Emergency Management Alberta. And in each of the provinces and territories of Canada, there is an EMO, and they follow an almost identical process. Now, it's been civilianized, so you take the word enemy out and you put hazard in, but it's the same process. And as we worked in EMA, one of the things I got to know was how the municipal government works. And every province and territory in Canada, the municipal government is different, because they're a product of the province. They belong to the province, and they're defined differently. So it's important to recognize differences between provinces. Every province has an EMO, and they're staffed and trained and fully equipped. The federal government has an EMO. It's called Public Safety Canada. Again, staffed and trained. And one of the things that that agency does is it identifies that which is most critical in their jurisdiction. So, for instance, within a province, there's an actual secret classified list of all the things that are most critical, and that's going to be important later in my presentation. And it's maintained on an annual basis. But what that EMO also does is it manages fires, floods, tornadoes, terrorism, and should have managed the pandemic. The Imperial College of London model had been completely debunked. It had been shown to be wrong in every major emergency in the past 10 years.
Lewis also notes that any votes on changes to international law through the WHO's proposed amendments to the well-established international health regulations would be done without due process. Member states are required to have 4 months to consider any changes, according to Article 55 of the IHR itself. Voting on them this week would disregard that. She also rightfully points out that the Canadian delegates present at the WHA would be acting outside of their scope even to consider these changes to legally binding international law. With approximately 300 sweeping proposed changes, the amendments would see a strengthening of the WHO's health emergency powers, and as Bill Gates, who happens to be the second largest funder of the WHO, previously put it, countries will comply and be graded accordingly or risk being blamed for future pandemics.
The WHO is going to need more resources to have a dedicated team, not just for when the epidemic comes, but to go to the world's countries and make sure that these drills are being done. You know, we do fire drills. The Defense Department does war games. We need for epidemics to practice. And so we need to be doing every 5 years a really comprehensive exercise at both country and regional level of pandemic preparedness. And you need a global group that's kind of scoring everybody and saying, hey, if you're not participating in this, you could be the source of the next pandemic, and that's bad for the entire world. This is like a fire that goes global.
In a leaked meeting between Canadian health overlords discussing the latest pandemic potential, H5N1 avian flu, Chief Public Health Officer of Canada Theresa Tam can be heard saying that the response is already adhering to the WHO's One Health strategy rhetoric.
So in pandemic protocols, we have methods to escalate, right? And you have special advisory committees, but this is a One Health construct, so this is a little bit new. So we need to kind of morph what we have into that, and it's prevention rather than an actual pandemic response. So the three of these different, let's say, contexts means that this is actually something a bit different to what we had before. So I think setting it up right would be important. And so in any case, we're trying to get a handle on the research and the additional, enhanced surveillance pieces from the provinces that we think might be doing studies and research. But what you're talking about is the overarching response, which point taken.
As the WHO approves a 4-year, $11.1 billion strategy for global health with an emphasis on climate change, aging, migration, pandemic threats, and there it is, equity, they call the next few years an exceptional window of opportunity to build resilient, fit-for-future health systems, to get back on track to reach the health-related sustainable development goals. Stay tuned as Rebel heads to Geneva in the coming days to cover the conclusion of the World Health Assembly and the citizen rally to follow at exposethewho.com. For Rebel News, I'm Tamara Ugolini. We are sending a team of rebels to cover the conclusion of the World Health Assembly and rally that will follow to be your eyes and ears on the ground in Geneva, Switzerland. But it isn't cheap, and if you value this kind of work, then please chip in to help offset the costs of our coverage and cover the costs of this crucial endeavor at exposethewho.com.